हे गाइज, वेलकम बॅक टू द चॅनल ऑफ आयुर्वेदा मराठी. तर आज आपण एक शॉर्ट रिव्हिजन घेणार आहोत ऑन द लिगामेंट्स ऑफ द शोल्डर जॉईंट. जर तुम्हाला कंप्लीट व्हिडिओ पाहिजे असेल तर तो ॲपवरती अवेलेबल आहे, बट दिस इज जस्ट अ क्विक रिव्हिजन. So first let's start with the articular capsule and the synovial membrane. आपण सांगितलं होतं की हे दोन लिगामेंट आपण कॉमनली सगळ्या जॉईंट्समध्ये लिहिणार आहोत. दॅट इज द articular capsule and the synovial membrane. Articular capsule is attached to the margin of the glenoid cavity including the glenoid labrum. What is the glenoid labrum? It is another ligament of the shoulder joint and to the anatomical neck of the humerus. Now the important point is, what are the two articulating bones or the articulating surfaces of the shoulder joint? It is scapula from the medially, specifically the glenoid cavity, and humerus laterally, specifically the head of the humerus. Correct? Thus articular capsule is attached from the margin of the glenoid cavity to the anatomical neck of humerus. Next is the synovial membrane. It is basically just lined up inside or to the inner surface of the articular or the fibrous capsule. Okay, next is the glenohumeral ligament. We know that glenohumeral ligament is further divided into three bands, that is superior glenohumeral ligament, middle glenohumeral ligament, and inferior glenohumeral ligament. Now let's start. The glenohumeral ligament extends from glenoid margin to the lesser tubercle and anatomical neck of the humerus. Okay, that is given its extent from where it starts to where it ends. Now the superior glenohumeral ligament starts from the glenoid margin to the upper part of the lesser tubercle, while the middle glenohumeral ligament goes up to the the lower part of the lesser tubercle, while the inferior glenohumeral ligament, it goes up to the anatomical neck. All of them start from the glenoid margin itself, but it goes to the upper part of the lesser tubercle, lower part of the lesser tubercle, and the anatomical neck according to superior, middle, and inferior respectively. Next is the coracohumeral ligament. Now its extent is from the coracoid process up to the greater tubercle. It's very simple, starts from the coracoid process and goes up to the greater tubercle of the humerus. If your concept of scapula and humerus is clear, then only you can do this quick revision very nicely. So make sure you study the bones first. Next is the transverse humeral ligament. It's nothing but it connects the greater tubercle with the lesser tubercle. Thus the intertubercular sulcus is then converted into a canal through which a very important tendon of biceps pass, which is a very important question asked for the viva. Next is the glenoid labrum, which is one we also discussed earlier. That is a fibrocartilaginous rim that deepens the glenoid cavity to avoid friction. Now the whole point of making a glenoid labrum is that the glenoid cavity is not very deep, thus can cause a lot of fracture when a trauma is seen. To avoid this kind of fractures in the shoulder joint, this cartilaginous rim is present on the glenoid cavity, making the glenoid cavity more deep. Thus there is less chances of dislocation of the shoulder joint. We have seen such points in applied anatomy as well. Now let's take a quick revision towards the diagram of the ligaments of the shoulder joint. So let's mark the borders first. Here I have marked the border. Now I'll be drawing the glenoid cavity here. So this is my glenoid cavity. Now I will draw the humerus bone here. This will be the greater tubercle and this will be the lesser tubercle. Okay, suppose. So this is the greater tubercle and this will be the lesser tubercle. Okay, now first we will be drawing the transverse humeral ligament that was between the greater and the lesser tubercle. So this is nothing but the transverse ligament, transverse humeral ligament. Next we will be seeing is the 3 bands of the glenohumeral ligament. First we can see the glenoid labrum, that will be this dotted structure is nothing but the glenoid labrum. Okay. Next we will be seeing the 3 branches of the glenohumeral ligament, which all were starting from the margin of the glenoid cavity but were ending at different places. The first one was going to the upper part of the lesser tubercle, the next one was going to the lower part of the lesser tubercle, and the last or the inferior was going up to the anatomical neck. Thus these are forming nothing but the glenohumeral ligament. Now we can also see the capsule formation here. So this will be the superior, this will be the middle, and this will be the inferior. Okay, and this will be the formation of the entire capsule, and to it will be lined our synovial membrane. So this dotted structure is nothing but the capsule. So thus it was very easy to study the ligaments of the shoulder joint. Hope you like the video, and all the best for your exams. Thank you.